went down to Sydney to see him, and my mother-in-law and my sister-in-law waited till I got there because they didn't know what questions to ask. What's happening?
They had no idea.
Why? What's this? All the doctors kept saying, we're giving you the syringe driver to control his pain. Nothing about dying, nothing about where this is going to lead to, what this progression is. And I said, do you understand what's happening here? And his mother said, John's mother said, oh, they're controlling his pain. And I said, he's dying. He's actually dying.
She thought he had months.
She thought he had a few months to live. I had to go and get the doctor to come back in, and Helen, her name's Helen, said to me, we don't know what to ask. What we would never have asked that. It was not something that was even in our radar. We just thought, yeah, they're controlling his nausea and his pain.
Well, we'd hope that you get a referral to myself, and we would organise a case conference where we would actually get everybody in the room together and we would discuss and make sure, and my job would be to facilitate that discussion.
She would make sure you wanted that to happen.
So, yeah, I would check with you, and then but I would also be in the case conference because I would be saying, do you understand what was just said to you? Can you feed that back to us? I would be checking with people that they actually know what is being said, because we do use a lot of jargon and we don't even realise it because we do it every day, as the wood for the trees thing. So we need to really demystify some of that language. We also have to check what pain is. Are we talking about someone who's actually dying? Therefore, do they want to be in pain? That's the whole advanced care discussion. Look, I think communication is a big thing, and I think it comes down to communication from both avenues.
Yes.
I think the GPs need to get much better at saying, look, one question I haven't asked you is, how is your pain level compared to last visit? You know, and just make that a question that they can ask.
And walk in and say, these are my problems.
Yeah.
Don't wait for the doctor to second guess it,
Yep.
try and get it out of you. Walk in with a paper list. These are my problems.
And be prepared that one medication isn't going to be the be-all and end-all. There may
And
be
to
several that
return.
you have to try. And the other big thing
I hate taking pills.
It changes. It's not a constant,
that's right.
and people forget that.
You know, it's true that often after you've had cancer, as I did when I was in my 30s, I had a lot of bone pain in my femurs in particular because I'd had so much surgery to my femurs previously, and I think pain often shows up in the weakest area of your body, and mine was leukemia, so I didn't have cancer in one sort of place in my body, but I did experience a lot of bone pain. But of course, and my glands in my neck often would come up and get very hard and sometimes very painful. And for probably 3 or 4 years after I was in remission from cancer, every twinge I got, every headache was a brain tumour, every ache or pain, I interpreted that as, oh, it's back, it's back. And I think it's very normal and very human when we've been through a fairly scary experience that we interpret every symptom that we experience after that. We forget that we're getting older, or that everybody experiences aches and pains at some time in their life. But once you've been through the experience of cancer, it's quite frequent that people will ascribe every symptom that they have to cancer. Again, that's why it's very good to have this in a healthy perspective, so that you can reassure yourself, no, this is not necessarily anything to do with cancer at all. Because, of course, if we live in a heightened state of anxiety, that every pain we experience or every twinge that we have, and we experience a lot of fear and anxiety around that, that's a biochemical state that we're producing in our body that's not going to be at all helpful either to the pain that we might be having, and of course to live with those heightened levels of cortisol and adrenaline and some of the chemicals that we produce when we're feeling anxious and fearful. They close down your immune system. And so that's not going to be a helpful thing for you long term either, because you want a really healthy, vibrant immune system that can keep you feeling healthy and your body feeling healthy.
The majority of your pain is actually from the emotions of it. When you're first diagnosed with cancer, I think you're thinking not only of the pain for yourself, but the pain and suffering, in my instance, of 4 children that I had. So you've got a lot of emotional baggage that I suppose comes along with the cancer. And if you're not dealing with that side of the emotion, because I was actually separated for 10 months with my treatment, so I was in Sydney and my children were here in Armidale at boarding school because I thought that was the best place for them, so that they weren't impacted significantly with my journey again, because they'd only been through that 2 years prior. So I had to really most probably get over that part of leaving the children behind before I could actually do my own journey. So I took 3 months to actually commence my treatment, to just get my mind in control to go on with the journey.
Many people, I've worked with thousands of people with cancer, and many people with cancer don't experience any pain at all. Those that do often find that the sorts of things that impact on their experience of pain are if they're tired, if they're bored, if they've overdone things. And so some of these reflective things that we talk about in our residential program, our Taking Control of Chronic Pain retreat, is really about understanding yourself and looking at all of those other aspects of your life that you have control over. Being able to get good quality sleep, having some control over what's happening to you during the day, having some practical skills and strategies to draw upon so that you don't feel like you're just a helpless victim of your circumstance. It's really important to step into that role where you feel like this is the situation that I'm in, and I've got a whole range of skills and strategies, whether that's using medical strategies, using psychological, emotional, things like mindfulness, meditation. There are many different strands that people can pull upon so that they have a positive relationship, or as positive as possible a relationship with chronic pain if they are having pain when they're dealing with cancer. I think it's not always true to say that we can manage all pain and get rid of all pain, but we can certainly, if we're diligent, find really skillful ways of both using perhaps some pharmaceutical interventions, but as well as that, there are things like massage, things like gentle movement, exercise, meditation, mindfulness, all of these other things that are within your own control that will make a significant difference to how you experience physical pain.
But it's important that you tell people of all the types of pain that you're having. Some of it might be insignificant and others might be quite significant.